Let me ask you something. If you are living with type 2 diabetes, prediabetes, insulin resistance, or high fasting blood sugar, have you ever been told to avoid milk completely? Maybe someone told you, milk has sugar, so diabetics should never drink it. Or maybe you heard the opposite online, that one special milk can magically wash high blood sugar away and reverse diabetes quickly. The truth is more balanced than both of those extremes. Some milks can raise blood sugar faster than people expect. Some milks are loaded with hidden sugar. Some are marketed as healthy, but behave more like dessert in the body. But the right milk, used the right way, may help support steadier glucose, reduce post-meal spikes, and make your breakfast or evening routine much safer for your blood sugar. No milk cures diabetes. No milk replaces your medication. No milk replaces your doctor, your glucose monitor, your HbA1c test, or your daily food choices. But choosing smarter in the milk aisle may be one of the easiest changes you can make this week. I am Dr. Arthur Mark, and today I am going to walk you through the milk choices that may help support better blood sugar control, reduce glucose spikes, and help slow the progression of type 2 diabetes when used wisely. Before I get into the first one, do me a quick favor. If you want more videos that explain what your body is doing and how to support the root of the problem instead of just chasing symptoms, hit subscribe, give this video a like, and leave me a comment telling me your latest fasting blood sugar or HbA1c number if you know it. You can simply write fasting 140, A1c 7.2, or I am pre-diabetic. I read those comments and they help me know what diabetes topics to explain next. So let us get into it. Here is what many people misunderstand about milk and diabetes. Milk is not only one thing. There is regular cow's milk, lactose-free milk, ultra-filtered milk, almond milk, soy milk, oat milk, rice milk, coconut milk, kefir, yogurt drinks, protein milk, and flavored milk. They all look similar on the shelf, but inside your body, they can behave very differently. The main thing you need to watch is not the color of the carton, it is the label. How much sugar does it have? How much protein does it have? Is it unsweetened? Is it flavored? Does it contain added sugar? Does it give you protein, or is it mostly watery carbohydrate? That difference matters because blood sugar is affected most by carbohydrates, especially fast-digesting sugar. But protein can slow digestion, support muscle, reduce hunger, and help soften the glucose rise after a meal. This is why two people can both drink milk, but one person gets a big spike, and the other person gets a much steadier reading. The milk is different. The timing is different. The meal around it is different. And the body's insulin response is different. That is why today I do not want you to think, is milk good or bad? I want you to ask a smarter question. Which milk, how much, at what time, and with what food? That is where the real blood sugar answer lives. Let us begin with number 5. Number 5 is lactose-free or ultra-filtered cow's milk. This is a good place to start because many people love the taste of regular milk, but they notice it may not always love them back. Regular cow's milk naturally contains lactose. Lactose is milk sugar. Even though it is natural, it is still a carbohydrate, and carbohydrates can affect blood sugar. A typical cup of regular milk can contain about 12 grams of sugar from lactose. For some people, that may be fine in the right portion. But for others, especially people with type 2 diabetes or insulin resistance, that sugar can create a larger rise than they expected. Ultra-filtered milk is different. It is filtered in a way that removes some of the lactose while concentrating the protein. That means you may get more protein and less sugar in the same cup, and that is exactly the combination we want when trying to keep blood sugar steadier. More protein, less sugar, better fullness, slower digestion. Lactose-free milk works a little differently. The sugar is still present, but the lactose is already broken down by an enzyme, making it easier for many people to digest. This can matter a lot after age 50 or 60, because digestion often becomes more sensitive with age. Some people who tolerated milk well when they were younger begin noticing bloating, gas, diarrhea, or stomach discomfort later in life. Now let me make this practical. Imagine a woman named Linda. She is 64. She has type 2 diabetes. Every morning she drinks coffee with milk and eats a small breakfast. She thinks she is doing everything right, but her glucose monitor keeps showing a rise after breakfast. She does not want to give up milk completely. So instead of quitting, she switches from regular milk to an unsweetened, ultra-filtered milk with higher protein and lower sugar. Same coffee, same morning routine, but now her body has less sugar to handle and more protein to slow the rise. That is a realistic change. Not extreme, not scary, not impossible. Just smarter. If you want to try this, look for unsweetened, ultra-filtered milk or lactose-free milk with higher protein and lower sugar. Do not trust the front of the carton. Flip it around and read the nutrition label. And here is your first comment question. If you drink milk and coffee or tea every day, comment coffee or tea below. I want to know how most of you are using milk, because that helps me make the next video even more practical. Now let us move to number 4. Number 4 is plain kefir or unsweetened drinkable yogurt. This one is different because it brings your gut into the blood sugar conversation. Kefir is a fermented dairy drink. Plain drinkable yogurt can also be fermented. Fermentation means helpful bacteria have already started breaking down some of the milk sugar. These bacteria are often called probiotics. Why does that matter for diabetes? Because your gut is not separate from your blood sugar. The bacteria in your digestive system can influence inflammation, appetite, digestion, insulin sensitivity, and even how your body handles glucose after meals. Now, I am not saying kefir cures diabetes. It does not. But plain, unsweetened kefir may be a much better choice than fruit juice, soda, sweet tea, flavored yogurt drinks, or sugary coffee drinks. Here is the problem. Many yogurt drinks in stores are marketed as healthy, but they are loaded with added sugar. Some of them are closer to dessert than a diabetes-friendly drink. So the keyword is plain. The second keyword is unsweetened. If the label says strawberry, vanilla, honey, mango, or sweetened, check the sugar very carefully. Let me give you an example. Imagine Frank, age 70. He wakes up tired, drinks orange juice with breakfast, and then feels sleepy again 2 hours later. His blood sugar rises quickly because juice has fast sugar and almost nothing to slow it down. He replaces the juice with a small glass of plain kefir. Now he is getting protein, live cultures, and a slower digestive effect. That does not make breakfast perfect, but it changes the signal his body receives. Instead of fast sugar, he gets a steadier drink. If you try kefir, start small. A few ounces with a meal may be enough. Some people tolerate it beautifully. Others need time for the gut to adjust. And if dairy causes stomach problems for you, do not force it. The goal is not to suffer. The goal is to find what your body handles well. Now I want you to comment this if it applies to you. If you have ever noticed bloating, gas, or stomach discomfort after regular milk, write "milk bothers me" in the comments. That tells me many of you may need a separate video on lactose, digestion, and diabetes. Now let us talk about a milk that is very low in sugar. Number 3 is unsweetened almond milk. This may be the lightest option on the list, and for some people, it is the easiest place to start. Unsweetened almond milk is usually very low in carbohydrates. That means it has very little sugar to raise blood glucose. For coffee, tea, smoothies, and low-carb breakfast bowls, unsweetened almond milk can be useful because it gives you the creamy feeling of milk without the same sugar load as regular milk. But there is one major warning. Sweetened almond milk is not the same thing. Vanilla almond milk is not always safe. Chocolate almond milk is usually not a blood sugar food. The word almond does not automatically make it healthy. You must look for unsweetened. This is where many people get tricked. They switch from regular milk to almond milk, but they choose the sweetened version. Then they wonder why their glucose did not improve. The problem was not almond milk. The problem was added sugar. Now here is the honest downside of almond milk. It is usually low in protein. That means it may not keep you full for long, and it may not support muscle the same way cow's milk or soy milk can. This matters especially after age 60, because muscle is one of the main places your body stores and uses glucose. The more muscle you lose, the harder blood sugar control may become. So almond milk can be great as a low-sugar base, but do not pretend it is a high-protein food unless the label says protein has been added. Use it in coffee, use it in tea, use it when you need low sugar. But make sure your meal still contains protein from somewhere else, such as eggs, Greek yogurt, fish, chicken, tofu, lentils, or another protein your doctor approves. Let me give you a simple test. If you use almond milk and feel hungry again 1 hour later, the issue may not be blood sugar alone. Your meal may simply be missing enough protein. This is where people make mistakes. They choose low sugar, but they forget fullness. Then they snack later. And that snack may raise blood sugar more than the milk ever would have. So use almond milk wisely, not as magic, as a tool. Now comment below if you have ever tried almond milk. Write almond milk if you use it already, and write never tried if you have not. I want to see how many people are already using it. Before we move to number 2, do me another quick favor. If this video is helping you understand blood sugar instead of just fearing it, like the video and subscribe right now. And in the comments, tell me this. Do you check your blood sugar after meals or only fasting in the morning? Write after meals or morning only. That one answer tells me a lot about how you are managing diabetes. Now let us move to number 2. Number 2 is unsweetened soy milk. For many adults with type 2 diabetes, unsweetened soy milk may be one of the best all-around choices in the milk aisle. Why? Because it gives you something almond milk usually does not give you enough of: protein. Unsweetened soy milk is usually low in sugar and higher in protein than most plant-based milks. It is also one of the few plant milks that contains complete protein, meaning it provides all the essential amino acids your body needs. That makes it more satisfying. It helps with fullness. It can support muscle. And it may help reduce the blood sugar spike when used with a meal. This is why I often say soy milk is not the flashiest choice, but it may be one of the most useful. Now, I know some people are nervous about soy. They have heard confusing things online. Some say soy is bad. Some say it is amazing. The truth is more balanced. For most people, unsweetened soy milk can be a reasonable, heart-friendly, blood sugar-conscious choice. But if you have a soy allergy, thyroid concerns, hormone-sensitive medical history, or your doctor told you to avoid soy, then follow your medical guidance. We are not forcing one food on everyone. We are helping you choose intelligently. Imagine Harold, age 67. He has type 2 diabetes and his cholesterol has been creeping up. He wants a milk alternative that does not spike his sugar but also does not leave him hungry. He tries unsweetened soy milk. He uses it in coffee, in oatmeal, and sometimes drinks a small glass with breakfast. Now he gets a low-sugar drink with meaningful protein. And for him, that is better than sweetened plant milk or regular high-sugar drinks. This is the kind of decision that can quietly improve the day. Not because one glass fixes diabetes, but because one glass replaces a worse choice. And when better choices repeat every day, the body notices. If you want to try soy milk, choose unsweetened and fortified. Fortified means nutrients like calcium and vitamin B12 may be added back, which matters if you are replacing dairy. Again, read the label. No added sugar, good protein, simple ingredients. That is the goal. Now let us come to number 1, and this is the most important part of the entire video. Number 1 is not a specific milk. It is the protein preload method. This means drinking a small amount of unsweetened high-protein milk before or with a carbohydrate meal. This can be ultra-filtered milk, high-protein dairy milk, or unsweetened soy milk. The idea is simple. Protein reaches the gut first. That can slow stomach emptying, reduce how quickly carbs hit the bloodstream, and help your body respond more steadily. In plain language, the milk acts like a buffer, not because it destroys sugar, not because it cures diabetes, but because protein changes the timing of digestion, and timing matters. Let me show you what this looks like in real life. Imagine Rose, age 73. Every morning she eats oatmeal or toast, and every morning her glucose jumps higher than she wants. She does not want to give up breakfast completely, so she tries something simple. 10 minutes before breakfast, she drinks a small glass of unsweetened high-protein milk. Then she eats her normal breakfast, but maybe with a little less carbohydrate and a little more protein. Her blood sugar curve becomes calmer. Not perfect, not magical, but better. The same food, in a smarter order, can create a different response. This is why I keep saying food is not just calories. Food is information, and food timing is part of that information. If your highest blood sugar happens after breakfast, this method may be especially worth discussing with your doctor or dietitian. Try a small amount first. Do not drink a huge glass. You are not trying to overload calories. You are trying to gently support digestion and glucose control. A practical amount may be around 150 to 200 milliliters, depending on your needs, your appetite, and your medical plan. You can use it before oatmeal, toast, cereal, rice, or another carbohydrate meal. But here is the warning. This does not give permission to eat unlimited carbs. If you drink protein milk and then eat a giant bowl of sugary cereal, pancakes, syrup, juice, and sweet coffee, do not blame the milk when the meter goes high. The milk is a tool. The meal still matters. So let us bring this together. Number 5, lactose-free or ultra-filtered cow's milk. More protein, less sugar, and easier digestion for many people. Number 4, plain kefir or unsweetened drinkable yogurt. A fermented option that may support the gut and replace sugary drinks. Number 3, unsweetened almond milk. Very low sugar, useful for coffee and tea, but low in protein. Number 2, unsweetened soy milk. A strong all-around choice because it gives low sugar and meaningful protein. And number 1, the protein preload method. A small glass of high-protein milk before or with carbohydrates to help support steadier post-meal blood sugar. Now I want to give you the 3 biggest mistakes people make with milk and diabetes. Mistake number 1 is trusting the front label. The front may say natural, plant-based, healthy, vanilla, organic, or heart smart. None of that tells you what it does to your glucose. Turn the carton around, look at total carbohydrates, look at added sugar, look at protein. That is where the truth is. Mistake number 2 is drinking flavored milk. Chocolate milk, strawberry milk, vanilla milk, sweetened plant milk, and coffee cream drinks can contain enough sugar to spike glucose quickly. If it tastes like dessert, your meter may treat it like dessert. Mistake number 3 is drinking milk alone when your body needs a balanced meal. Some people drink milk because they are hungry, but they do not eat enough protein, fiber, or healthy fat. Then they get hungry again and snack on something sugary. Milk works best when it is part of a plan. Use it with protein. Use it with fiber. Use it with a balanced meal. Do not use it as a cover for a high sugar pattern. Now here is your simple 7-day challenge. For the next 7 days, change only one thing. If you drink sweetened milk, switch to unsweetened. If you drink regular milk and spike, try ultra-filtered or lactose-free milk. If you use sweet coffee creamer, try unsweetened almond milk or unsweetened soy milk. If breakfast spikes you, try the protein preload method before that meal. Then check your glucose. Not once. Watch the pattern. Your body will teach you if you pay attention. And I want you to comment your result. If your fasting sugar is high, comment morning sugar. If your sugar spikes after breakfast, comment breakfast spike. If you do not know your numbers yet, comment I need to check. That helps me understand where you are, and it helps other people realize they are not alone. Before we finish, let me be very clear. If you take insulin or blood sugar lowering medication, changing your diet can affect your readings. Monitor your glucose carefully and work with your medical team. Do not stop medication on your own just because you changed milk. Diabetes management is not about guessing. It is about measuring, learning, and adjusting safely. And one more thing. Do not let fear control every food decision. Some people become so scared of blood sugar that they stop enjoying life. Others ignore the problem completely until complications begin. The better path is in the middle. Learn your body, read labels, use your meter. Choose smarter. Repeat what works. That is how progress happens. Not through one miracle milk, not through panic, through honest daily choices. If this video helped you, subscribe to Dr. Arthur Mark, like this video, and share it with someone who has type 2 diabetes, prediabetes, or high fasting blood sugar. And before you leave, comment 3 things if you know them. Your latest fasting blood sugar, your latest HbA1c, and which milk you are going to try first. You can write it simply like, fasting 135, A1C 7.1, trying soy milk. That kind of comment helps me make better videos, and it may help someone else feel less confused. Remember this, your blood sugar is not your identity. It is information. It is feedback. And when you learn how to use that feedback, you can start making better choices one meal at a time. Start with one carton, one label, one breakfast, one better routine, and let your body show you what works.